So first I enter into the room, I wash my hand, and examiner is giving that do the general examination of the child. So first I wash my hand, I am introducing to the mother. Suppose the child is Meera and mother is Fatima. I'm greeting I give my mark sheet to the examiner with a smile, and I'm greeting the mother. Hello Fatima, I'm Dr. Ima, one of the candidate today. I am to examine Meera. So, hi Meera, how are you? Meera is well communicating. She is telling, yes, I'm fine. So, which class you are studying? She is studying class 7. She is a 14 years age old girl. Okay. In the meantime, I'm looking her fully. I find that she is short, according to 14 years age old. She's very short, and there is. No dysmorphic features I find, but I am looking that her neck is small. There is webbed neck. When I notice that she is a girl, and surrounding there is no device attached, the child is not distressed, these are I'm saying general condition is normal. After inspection, then I look at her neck. Neck I find the short and webbed neck, locet ear. Her ear is also locet. I am saying. So in neck I find there is no any goiter. I am searching goiter. Then I tell her, can you remove your shoe? So she is remove her shoe. She is standing. I look at her leg, fully noticing the leg. Anything in the leg, nothing I find. Then I am going to the back. Back I also not find anything. Leg back. Then I tell her, do the Byton score like that. Please do me. So Byton score is also negative. Then gait I tell her, can you please walk and come back with. Then she goes walk to the opposite side of the room and come back. So then wait, then measurement I tell her, can you please stand. I stand her opposite a wall. Her four part of the body are touching the wall. Standing height I am noticing. Then I give a sheet and tell her to sit there. So she sit. I measure the both standing height and sitting height. She is a proportionally short stature. Then I tell her, can you please do like me? I'm doing some maneuver. First of all, I look at her hand, inspecting her hand. When I notice her hand, I find that her fourth and fifth metacarpal bone is short. Finger is short. Okay. Then I tell her, can you do like symmetry? I'm checking. Both are symmetrical. Then I am telling, place the hand behind your body. So it is normal. Then cubitus valgus I am checking. There is cubitus valgus is positive. Then rhizomelic or I am checking. This is also normal. Make a fist, make a star. Make a fist, make a star. I find there is short fourth and fifth metacarpal bone. So 6 maneuver I done. First of all, symmetry, cubitus valgus checking, length of the arm, and then the rhizomelic, then the make a fist, make a star. So 6 after, then I will check the pulse. I find there is a 3D pulse, and I radial delay. I also find radial delay. I check that. Then I go her. I can tell her open the mouth. She open the mouth. I don't find anything like high aspirate. Nothing. I checked. Then I go the chest. I want to expose the chest. I find white space nipple, and also I check the murmur, and I find there is a murmur positive systolic murmur. Then I go abdomen, I watching, and lower limb there is some pitting edema present or not I am showing. So now I presenting my case. Today I examine Meera. I find she is communication is well. She is short in proportionally short stature, and I find there is web neck, low posterior hairline, and the locet ear. So when I check the back, I check the low posterior hairline. These are present. I find there is short fourth and fifth metacarpal bone, wide space nipple, wide carrying angle. There is 3D pulse, radial delay present. There is a murmur present. These are I find. And hyperconvex nail. Also nail, when I check, I find hyperconvex nail. So putting together, I think it is a case of Turner syndrome. The next question, what is the management? I would like to complete my examination asking the mother, is there any neonatal period, any lower limb edema present or not? Child has any hearing loss, sensorineural hearing loss, repeated ear infections, how about development, rechecked or not? And I also measure the forelimb blood pressures. And also these are I would like to complete my examinations. Then management, first of all I take the history, then I will run investigation. Investigation is the genetic test and karyotyping 45XO. Then also we find the sex hormone testing. We find increased FSH and LH, decreased estrogen, the hypergonadotropic hypogonadism. Then I do the associated thyroid function test, celiac screening. These are, and the echocardiography as coarctation of aorta, bicapsular aortic valve associated with Turner syndrome. Ultrasound of the abdomen, horse-shaped kidney is present. Then hearing assessment, I want to speech and language therapist. These are. I'll involve the multidisciplinary team to management the child, first of geneticist, cardiologist, speech and language therapist, lies with the school, psychological support to the family, pulmonologist, nephrologist, developmental pediatricians, gynecologists. These are I involve. What is the endocrine problem in Turner syndrome? They are short stature, they have hypothyroidism, they have infertility can be present. Treatment is growth hormone and estrogen. So one question come from Turner syndrome. What is the question? That is the Tanner staging. So Tanner staging, if we go first, if we go the pubic hair, P1, P2, P3, P4, P5. P1 there is no any pubic hair. P2 there is some pubic hair, fine. P3 there is P3 there is we find some pubic hair, but their extents increase the amount. P4 they have also adult type pubic hair, but it is small amount, and P5 there is fully mid thigh extents. Axillary hair, A1, A2, A3. A1 there is no axillary hair. A2 there is some axillary hair, but it is not adult type. A3 there is adult type axillary hair. Now breast development, B1, B2, B3, B4, B5. B1 there is no that is prepubertal, no breast development. B1, B2 there is breast bud development. B3 breast mole development. B4 it is developed but it's not adult type, and B5 adult type. Now going to the genitalia testicular volume in boys, G1, G2, G3, G4, G5. G1 is a prepubertal, there is a testis volume is less than 4 ml. G1, G2 there is some scrotal laxity develop, 4 ml maybe testis volume. Then we go the G3. G3 there is phenyl lengthening occur. G4 it is broadening occur, and there is 10 to 12 ml testicular volume, and G5 there is fully adult type, 15 to 25 ml. So again telling what is the features we can find in Turner syndrome when I examine. First of all, she is proportionally short stature, she is communicating well. What I find on the head hyperconvex ear, in the hand hyperconvex nail. I find she is symmetrical hand, but white calyx angle, white cubitus valgus, short neck, low set ear, low pubic hairline. These are the feature: hyperconvex nail, low fourth and fifth metacarpal bone is short. They have we find there is thready pulse, murmur present. This is the features of Turner syndrome.